the last speaker of this part of the session will be Dr. Sonu Bhaskar, who is so much that and so many things that I really cannot get into all of that. He's from the medical background with an expertise in stroke and neurology, but he's also engaged as a physician, citizen, I would call him, in many applied ethics, medical ethics projects. And he will introduce himself better than I can do it right now without wasting more time. Dr. Bhaskar, please take the microphone.
Thank you, Professor Doring, and everyone joining from different parts of the world, and big warm greetings from down under in Australia. It's 10:51, close to 11 p.m. in Sydney, and a warm greetings to all of you. And I acknowledge that many of you have been harmed in one way or the other by COVID-19, and my thoughts and compassion with you all. Well, today the topic, before I delve into this, I want to make sure that it's really about fun and also consideration for ethics as a topic that needs to be discussed at an early stage of the formative years rather than an afterthought. And I hope that some of the things we will discuss today will initiate discussions around those facts and theories. Well, thank you, Chair Dr. Ole Doring and the organizing committee, Professor Su, for the invitation to share my thoughts on ethics and policy considerations for genomic technologies. Well, we all know that the rapid research, development, and advancements in the field of genomics technologies has really called for a critical debate on what are the implications and what are the implications for and with ethics and policy. The question is, how do we ensure that current ethical frameworks are applied, and most importantly, where and when they should be applied, and to ensure that these application of these frameworks protect the vulnerable communities. And I think at the beginning of this session, you have heard from Professor Yilma, and he shared some of his insights from African continent. And while we are thinking of ethical frameworks, we must acknowledge much of these frameworks are driven from a particular part of the world, and it needs to consider thoughts and diversity of thoughts from different other parts of the world, which includes Asia and Africa, including China is also a leading player in that. So we will discuss some of the case scenarios around ethical and policy issues today. And most importantly, I'll end up with some policy recommendations that we as physicians and thought leaders in the field can talk to each other more and discuss some of the ramifications of these technologies on our human population and society. Well, before I start the talk, I want to invoke a great thought leader and philosopher, Rabbi Simon Ben Gamaliel. He used to say that world rests on three things: the justice, the truth, and the peace. And I quote the Avot from the Torah's the chapter 118 column. Well, the question is why we are here today. We are at the crossroads. Why? Because the emergence of genomic technologies, novel vaccines, artificial organs, technology, robotics, and really so on and so forth, blockchain included, are fundamentally asking us to ask questions broadly in the M of healthcare. And these questions are that, what are the impact of these technologies on our healthcare, on our workforce, and most importantly, on the society? Now let's talk genomics, shall we? Well, genomics calls into question well-established individual-focused norms of 20th century bioethics. I think Professor Crawley touched base on some of these aspects. And the question is that till this time, we have been very comfortable in using those ethics and moral principles to see that how it will work in doctor-patient relationship, and how that those can drive our public faith in medicine in many of the Western nations. But as I discussed, some of those principles sometimes fail to account for the vulnerable communities, and most importantly, from the under-resourced settings. So those voices of diversity are missing. Well, my question is that the principle of non-maleficence, as you all know, and the principle of precaution really puts emphasis on prioritizing harm, avoiding harm, and making sure that the benefits of this are to protect the autonomy of the individuals, autonomous decision-making, and the personal liberty. In a nutshell, today's bioethics really focuses on avoiding harm over maximizing benefit. The question is, how do we develop framework that apply the principles of of beneficence and non-maleficence, while encouraging research to promote human health, which in Dr. Doring's words, salutogenesis approach to human health, and to avoid unscrupulous use of individuals in research and to potentially mitigate harm to those participating in research and most importantly to our patients. Well, as the community becomes more informed about genomics and technologies, the questions about appropriate use of genomic testing, screening, and pharmacogenomics really becomes very topical. This has brought to us specific concerns around personal genomics. As you've seen now, these new advertisements on recreational genomics are popping up on our desktops at times. And there are also concerns around non-medical uses, such as the assessment of using genomic technologies of athlete abilities in children. And I think also Dr. Wallace touched base on application for ADHD or autism patients. So there are a lot of concerns that are popping up in our day-to-day practice, so on and so forth. Well, beyond the individual focused solutions and ethical constructs, there is a general debate that can we apply social construct principle and framework between our discourse in medicine and society. Now let's look at this social construct framework in deeply. The social contract framework was propounded by the 17th and 18th century philosophers, Locke, the Rousseau, and the Rawls of the world, which really described a set of formal and informal norms as well as rules underpinning expectations of the rights and the duties of citizens. Now, coming back to the present world, is there a need for a new social contract for genomic medicine, as it's being propounded by some of the quarters in some parts of the world? And what are the ramifications of that particular framework on the developing countries, on the most vulnerable communities? Is there a need for focus on collective dimensions of genomics and its importance of community participation, public interest, and trust, which Mr. Sang also talked about in detail? What is common good? And the question is, how do we define solidarity? Is the word solidarity becoming more rhetorical at times? Now let's look at some of the case studies from Europe. So we have the British the National Health Services from the UK, whereas in the spring of 2021, the NHS is rolling out genomic medicine services across the NHS hospitals and facilities, which is to provide access to genetic and genomic testing across the UK through the public health sector. It's a huge step in integrating genomics, which has been primarily in the realm of the research, into public practice. But it has also wider ramifications for the general society, which we must ask and debate about. France, on the other hand, is piloting exciting genomics projects which aims to improve diagnosis, prognosis, and treatment of cancer and rare diseases, intellectual disability syndromes included. So there, in some quarters in Europe, there is a wider integration of research realm genomics into clinical practice. So the debate is definitely topical. Now let's challenge some of the norms that is being discussed today, and I think some of the speakers before have touched base upon. Has the emergence of genomic technologies changing the way we healthcare professionals are dealing with our patients and community at large? Because many of the boundaries that existed before are being breached in one way or the other. What about the duty of care to recontact patients if the understanding of the implication of the detected variant changes since the time of testing? So when a genomic test is performed, there may be an unexpected finding that are not only relevant to the patient, but also to the broader family. Is there a duty of care for patient, a respect for his confidentiality and duty to use this information for his family and for his own confidentiality? We must balance collective and family responsibilities against individual rights. And it's really through the respect to patients and of course the family members, without the need to decide in the favor of or against the breach of confidence. I think some of these frameworks have been touched base upon in UK, while these rolling out of genomic technologies are being considered in these countries. But broadly speaking, in many other developing nations, these notions are at its infant, to say the least. There also, the boundaries are being blurred between our research and our clinical care. When we as clinicians will now be targeting patient, asking patient to go for a particular test, where we particularly, I mean, physicians included, needs to be informed, because not all physicians have been educated about the use of genomic technologies, and really to interpret those complex information coming out of those technologies in the clinical realm. So there is need for education, not just for community, but also for physicians involved in applying and testing these technologies, or applying these technologies in daily care. What about the duty of feedback, as I said before, to report clinically significant research findings to patient and family members? And there, of course, there are issues of communication that which really brings forth the additional research findings which may pop up in your investigation. How do we report back? Where is the concept of liberty and autonomy plays into it? Where is the breach of privacy? And those considerations needs to be considered in a broader scale. Last but not the least, I want to invoke some of the things that Mr. Sang talked about, the public involvement, democratic sharing of knowledge. And I believe as we move forward in this realm, we need to empower our communities through democratic sharing of the information and how we make decision-making, not just open, but also democratic. Really where we can address concerns about public understanding and acceptance of genomics and genetics. It doesn't have to be a one-way communication. It needs to be a multi-partite communication where we involve communities, and not just experts talking to the public, but public talking to the experts as well, where we feel humbled in one way and the other. And possibly adopting democratic procedures and tools. And I must admit that the technology, the software industry has been much more lucid to adopt those open, democratic, open access sharing platforms, and the medicine has been lagging behind. And probably learning from other sectors might inform us to see what are the best practices to move forward. Well, my final thoughts, I don't want to take much of time. Dr. Doring indicated at the beginning of this session, there is a unique opportunity with genomics to study and ethical and societal ramifications of these technologies, including artificial intelligence, as both of these technologies are talking to each other. We are applying artificial intelligence on genomics data, so on and so forth. So the question is, how do we talk about this in a respectful way, at the same time talking about the application and integration of genomic technologies in routine clinical care? There's also need for societal impact assessment. So before we develop technologies, not just an afterthought, let's just talk about what are the societal impact assessment, what are the impact of these technologies on the broader community, so on and so forth. And while we're doing that, let's do modeling of case scenarios and consult not just physicians, not just the community, but also the broader community about their interpretation. I know this process could be long, but it's worthwhile considering that. It builds public trust, which is important as we build these technologies for the future. The future of medicine will see continued expansion of innovations such as genomics. However, it is important that we ensure that the benefits of these medical innovations reach one and all in equitable framework. And I've just said that before, that the software industry has been an early adopter of open source development. Healthcare has been rather late in leveraging and applying such platforms or frameworks. Secondly, I also think that there is a shift towards social and ethical healthcare innovations. Increasing attention is being paid to what are the needs of the community and how innovations can address them. Ethics should not be an afterthought, but rather be considered at the conception and design stage of innovation pipeline. We must ask ourselves what our communities require, want, and how can we make these technologies address the social determinants of health? How can we make them socially responsible? One major concern here is the commercial determinants of health, which I believe that Dr. Doring has touched at the beginning of this session, really thinking about conflict of interest, so on and so forth, in a democratic and open way. One major concern, as I've said, that needs to be addressed because that is associated with escalating healthcare costs. So whether the future of genomics healthcare and technologies and facilities will be inaccessible to the most vulnerable communities. It's one thing to implement these technologies and for the benefit of populations, but what are we, who are the stakeholders here, who it will be serving, whether it will be privileged lot that will have the benefit of this technology, or we are also thinking about the most vulnerable communities. Well, the commercial determinants of health are a major issue for me, and I hope for all of you, because it merits global attention, as this is likely to exacerbate global North and South divide, including in the developed nations, as well as socioeconomic disparities that will continue to deepen, as we have seen during COVID-19 across geographies and communities. Fundamentally, towards the end of this conversation, I want to ask you, how should we integrate genomics into routine care? So as the solidarity aspects of integration and ethics and public trust be maintained, not just in the healthcare system, but also in all stakeholders. How best can we redefine the balance between individual rights and collective duties in the context of genomics medicine? And last but not the least, will the future of genomic technology serve the privileged or the underprivileged, or for all? Where the opinions of members of the poor and vulnerable communities? When we are discussing this, I hardly find representation from the vulnerable communities. Will it be limited to high-cost diagnostic or prognostic tests that only the privileged or the elite members of the community can achieve? Or we will celebrate health and salutogenesis approach to this, and that will be of benefit to the entire population of public health level. Well, at the end, and I hope this is a concluding thought, I want to ask you, let's keep talking, and these discussions help in building conversations around it. So thank you for this opportunity. Look forward to further questions. Thank you, Dr. Doring.
Thank you so very much, Dr. Bhaskar, for your most flamboyant speech. It's really very touching and quite fit, because you are connecting many of the aspects that we have heard about earlier today, and also in the other sessions of ICG-16. You are bringing us into a perspective. And when you mention a big task, actually, such as redefining non-maleficence and beneficence, what could it mean according to what we know today? And when you're talking about reinventing medicine and ethics, I guess, this reminds me of discussions that we had 22 or 21 years earlier, when it was all about, well, the bioethics of the 21st century. What are the challenges of the 21st century? I think the debates that we have led at that time, and I've been very much immersed in these discussions myself, were actually absolutely premature, because I think now, 21 years later, at the beginning of our new century, I think we are beginning to see the full scope of the issue first. And we have, perhaps we needed a wake-up call, such as the crisis COVID-19, to realize how vast and deep the problems are. So this is my attempt to wrap up this part of